Do you know that congestive heart failure is a growing global challenge, impacting at least 64 million lives worldwide? With an aging population, the current lifestyle change, we at Evergrowth are taking this condition seriously. As such, we are passionate in uncovering the current advancement and trend of heart failure to benefit you, your loved one, and the future of healthcare. Congestive heart failure occurs when the heart can't pump blood efficiently, leading to symptoms like shortness of breath, fatigue, and swelling. Yet early diagnosis and innovative treatment can make a difference.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging Biotech Hedge Fund, Evergrowth Biohealthcare Capital, we invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week Open Mic webinar. Topic for this week is congestive heart failure. We have the honor of having Dr. Van Nguyen, who is a cardiologist and also medical director of Baycare Medical Group. They are one of the largest hospital groups down in Florida. So I will share with you a summary of what Dr. Van shared with our team. Now, Dr. Van started out by defining or giving the definition of congestive heart failure. Is this the condition in which the heart fails to supply enough blood or adequate blood supply to the body?
As you can see here, most heart failure we understand is heart failure occur because of a weak heart. Normally, we give the patient a range of how much blood should be pumped out of the heart, and normal should be 55% or more. In congestive heart failure syndrome, we may have weak heart where the heart doesn't pump up to 55% of blood out to the body.
Then Dr. Van went into various causes of congestive heart failure, and it is due to coronary artery disease, which is a topic that we discussed in the prior week, high blood pressure or hypertension, also valve defect, cardiomyopathy, and congenital heart defect. Dr. Van went into that in greater detail.
And you see the etiology of heart failure here. We have varieties of conditions, including coronary artery disease that occur, as we touched on last time, build up a fatty deposit into the coronary vessel, result in heart attack and causing damage to the heart muscle, ultimately cause the heart to be weakened and inadequately pump out blood. We can also have high blood pressure that cause the heart to be overstressed or overworked. As you know, I correlate the condition of high blood pressure causing heart failure. We also have valve condition that cause the heart valve to be malfunction, inadequately open or inadequately closed, causing less blood to be pumped out of the body to meet the demands of the body requirements. And then you have cardiomyopathy that may occur either congenitally or occur because of various conditions such as ischemic, but also can be viral. And then of course we have congenital heart defects that someone was born with. And as they grow up their whole life, they have chronic heart failure because of that.
Dr. Van next discussed about the incidence of this condition. This is a very prevalent condition on a global scale. This condition, congestive heart failure, affects 64 million people worldwide. In the USA alone, that's 10 million patients affected or afflicted by this condition. Dr. Van then discussed about the type of heart failure, and they include the left-sided heart failure, right-sided heart failure, diastolic heart failure, as well as systolic heart failure.
So as I mentioned earlier, we have types of heart failure. We have left-sided, from the heart being weakened on the left side of the heart. Commonly, the fluid backups into the lungs cause patient to get pulmonary edema, but you also have right-side heart failure, result in fluid backup into the abdomen, the legs, and the feet as well. And a lot of people would have no significant symptom of shortness of breath per se, but they have fluid buildup in those areas. And as I mentioned earlier, we have stiff heart syndrome, such as diastolic heart failure, and then weak heart syndrome, occur as systolic heart failure.
Dr. Van shared with us about symptoms and signs of this condition like shortness of breath, persistent coughing, sneezing, wheezing, also swelling of the legs. Dr. Van then discussed its effect on the body.
As I mentioned, fluid retention, respiratory distress, fatigue, weakness, unclear thinking.
And he shifted gears to share with us on diagnostic approach.
Diagnosis, the physician would listen for the heart sounds, how the heart sound, such as heart murmurs or gallops, which is the sound when the heart is stiff, causing the heart to reverberate and it create extra sound when listening to the heart. We also have imaging tests such as echocardiogram, chest x-rays, CT, and then we also have blood tests to detect your blood count, your electrolytes, and especially a value called BN peptide level, which is hormone that we detect on the bloodstream when the lung being stretched from extra fluid accumulation.
Next, Dr. Van went over the treatment and outcome. The most important one is TLC or therapeutic lifestyle changes, which include improving your diet as well as exercise. Other treatment include the medication, the common medication like ACE inhibitor, beta blocker, diuretics to lessen the load on the heart. Also, other type of treatment for congestive heart failure include surgical treatment. If the cause is due to the defective valve, then you have valve replacement or valve repair. You can also have other surgical treatment like coronary bypass.
Of course, we have surgical treatment for underlying causes, such as if you have coronary artery disease, we can do percutaneous coronary intervention. If you have valvular heart disease, we can do percutaneous valvular intervention or surgical valvular intervention.
Dr. Van mentioned about the most commonly prescribed medication, which are the ACE inhibitor, the ARB, also the ANRI, which is a combination of both ACE inhibitor and also ARB. He mentioned some of the medication like empagliflozin, dapagliflozin, which are the novel medication, the new medication. Next, we also discuss about new medical trend in this area, which include gene therapy, a biomarker like the use of BNP to check for earlier diagnosis. Also telemedicine. Ways to improve this condition, congestive heart failure, as we discussed, include personalized medicine or tailor-made medicine that is specific for the patient. Also the use of AI and machine learning to help with the earlier diagnosis as well as following with treatment outcomes. Also, we discussed the aspect of microRNA and also wearable technology that allow us to monitor the disease and the condition for the patient. You want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise. Reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.